Welcome to The Remedy, brought to you by NYC Health Hospitals, innovating public health care to benefit all New Yorkers.
Hey everyone, I'm Dr. Michael Shen. Welcome back to The Remedy from NYC Health Hospitals. Today, we're celebrating an incredible achievement. All 5 of our skilled nursing facilities, that's Gouverneur, Seaview, Kohler, Carter, and McKinney, just were recognized by Newsweek to be among the best nursing homes in the nation for 2026. In fact, they all made it to the top 20 list, with Gouverneur as the highest ranking nursing home in New York City. That is a remarkable milestone for my guests today, and it's really a reflection of the high-quality care that our post-acute teams provide to over 1,700 residents and patients every single day. Today, we're going to explore what makes our nursing homes so good, from advanced memory care to traumatic brain injury rehabilitation, clean energy initiatives, and culturally competent care. So joining me are 3 leaders who have been at the heart of this success: Dr. Khoi Luong, our Senior Vice President for Post-Acute Care; Marian McNamara, our Chief Nursing Officer for Post-Acute Care; and Marisol Arroyo, our Post-Acute Care Quality Officer. Khoi, Marian, Marisol, welcome.
Thank you.
Good to be here.
Wonderful to be
Thank you
here.
for the opportunity.
I mean, post-acute care or nursing home care is such an important part of the healthcare landscape. And to have all of our nursing homes be recognized in such a way must feel so good and is such an accomplishment. So congratulations to all of you.
Thank you.
I'm honored to be able to talk to you about this achievement. So I wanted to go back to some of the basics. We talk about these terms, post-acute care, we're talking about nursing homes, but it's more than a lot of people kind of imagine in their minds. And obviously nursing home itself comes with a lot of baggage. So I want to kind of unburden that a little bit and also explain to people what post-acute care means to you all and means to our patients.
I will tackle that as generally as possible, and then I'll frame it in the context of our health system. Generally, post-acute care means any type of medical or nursing care that an individual can receive near or immediately after a hospitalization. This care can be received in many different settings. The settings that often we hear are like skilled nursing facilities, subacute rehab, inpatient, acute rehab, long-term hospital, home care. For our health system, with the post-acute service line, the service line entails a skilled nursing facility, a nursing home, and long-term hospital. The home care program, along with the acute rehab programs, are in other service lines. So that's not a part of ours.
Oh, I see. Okay.
Yeah.
And like acute rehab being the kind of care one might receive after they have a stroke to kind of rehabilitate them in a very short period of time.
Sure.
So what I guess just to summarize what we're talking about is, I'm a primary care doc, but I've done my time on the inpatient, taking care of hospitalized patients. When we discharge people from the hospital, oftentimes they have physical kind of needs. They need to exercise, they need to get back up on their feet, so to speak. And that's often done at these nursing facilities, skilled nursing facilities, which we refer to as subacute rehab. And then there's also longer term care that people receive at skilled nursing facilities if they, might need a ventilation device for a long time or need kind of other nursing to be there for that long time. So just to kind of clarify that term.
Our short-term rehab program is really post-hospitalization. They get rehab and other services to get stronger to go home.
Yeah.
Our long-term care residents, our nursing facilities are their home.
Yeah, got it.
Yeah.
That's a great summary.
Sometimes they stay with us many years. We have people that are 20, 25 years in our long-term population and a lot of, so they're family to us.
Yes.
Like we get invited to weddings and whatnot. It's unbelievable, the relationship, because it's not just the patients, it's the families. There is so much family involvement and it's wonderful.
And some of our residents don't have families, so our staff are their family.
Yeah.
We have a program, it's called Adopt a Resident. So if somebody doesn't have a family, they adopt a resident.
It's really nice.
Yeah.
And speaking of all the work that it takes to build this community around people who are staying there long term. Marian, you have over 1,600 nurses working across all 5 facilities, taking care of about 1,700 residents. Can you tell us a little bit about what that work looks like and what it looks like to run such a big nursing service?
Of course. So, like Mike, I always say that interviewing is such an important process for the nurses who work and the PCTs who work in long-term care, because you look for a person. Not everybody's meant to work in a nursing home. They're really not. And I could say that. I worked in acute care for many years prior to my nursing home. When I came into the nursing home, it was such a different nursing. And like one of the first days that I was there in Seaview, we had a Joint Commission survey. Right. And they make me take the Joint Commission lady around, not knowing anything about nursing home care.
And for those that don't know, the Joint Commission is the body that says whether or not you're allowed to continue to,
So it really takes a really special person to work in a nursing home.
Yeah.
So when we interview, I always look for the character of people. I spend an hour with them. I talk to them. Why do you want to work in a nursing home? And, from there, it just evolves.
Marisol, I wanted to ask you a little bit about your role as quality officer for post-acutes. What does that entail for that system? What does your day-to-day work look like?
Sure. So as Chief Quality Officer for the service line, my role is to oversee the quality and safety programs across the post-acute sites. So that includes quality, performance improvement, regulatory compliance, and then resident and staff engagement. So I'm very fortunate to work with not only Khoi and Marian, but the quality leads at each of the facilities and the interdisciplinary team.
And what are some of the kind of quality outcomes that you kind of look to change that have maybe led to some of the achievements that we've been talking about?
We're, again, very fortunate to be part of this health system that really focuses on quality. So we meet with the board on a quarterly basis. This is very, very different than many other skilled nursing facilities in the communities. And we share our quality data on a regular basis with the board. We work on our meaningful measures, which are hospitalizations, infections, but a big part of that is what's available to the public. So our quality measures is big.
There's about how many, you would say, on CMS website that we're...
So there's 15 quality measures that impact our star rating, and that gets shared with the board, and we're continuously improving those.
Yeah, so like at any one time, we're always thinking about the 15, and they, keeping those in balance is like pretty tough job. So in addition to that, there's other special initiatives that come about from a local level that's been identified, by quality champions there, recognizing there's an opportunity to improve, the facility leadership along with Marisol support that and to improve engagement. There's also a number of initiatives that stem out of the system's quality vision and agenda that we participate in and engage. And then there's certainly industry-specific ones that Marisol, Marian, and I will say, this is the trend. I think we need to, evaluate what that looks like for us, and then formulate, a plan, and then, make that a part of our quality agenda for like the year.
Very cool. Takes a lot to run a system like this. And speaking of our 5 post-acutes, I kind of want to take us on a virtual conversational tour of all of them. Maybe we can kind of walk through each one. And I know there's something special to point out about each of our facilities in terms of programming. So let's start with Staten Island. Seaview is in Staten Island, and it is where both you, Marian, and Marisol are primarily based and where you work from. Can you tell us a little bit about the traumatic brain injury program at Seaview?
So I had the pleasure to be the director of that for many years when I first started at Seaview. And I had a wonderful head nurse that worked there too. It's 21-bed certified brain injury unit. And I think it's a hidden gem because, we do a lot of work there. So we had a lot of vets there that were from Iraq and Iran that we took care of. It's an intensive 18-month program, and they get speech therapy, they get occupational therapy, they get physical therapy, and it's broken down because these residents get very tired during the day, and they need rest periods. Family involvement, some of them stay overnight in the program, all single beds. We need to have certain square footage from the state point of view. The program is amazing. It's really amazing. We take anybody from 16 and up into the program. We've had motor vehicle accidents, a lot of children, motor vehicle accidents that we've rehabbed. One that it's very dear to my heart. The child he didn't want to go away with the parents, and he was caught up in a wave in Virginia. And he suffered a traumatic brain injury, and he stayed with us for many years. And we really take very, very difficult cases, but we rehab them. And when you see them walk out, right, or can just stand from your wheelchair, you've known you've done something to help that resident and their family, So the program is wonderful. So many activities that go along with the program. It's an all-inclusive program.
In biology class, you learn how the brain is very plastic. It can recover, it can do lots of amazing things, but you don't really learn about what it takes to do that kind of rehab. Even for, in that story that you mentioned, a child who suffered some brain injury, taking years working alongside nurses and specialists to rehab and then maybe finally walk out. That's really amazing work.
And the families cannot be thankful enough for what you do. It's so rewarding, I will tell you. And, it's like they're your family, because they're so long. And then after they do the extensive rehab, we have an extended brain injury unit that they could stay for a limited amount of time, we've had a lot of people in there too.
Khoi, I know that CVU also specializes in Alzheimer's and dementia. Can you tell us a little bit about that program?
A critical principle in dementia care is individualizing the care to the patient. And CVU is like an expert at really getting at the core, making care very patient-specific. We do that because CVU really has ample staff. The staff are dedicated. They are specially trained through certified dementia training that they're put through. And there's a great interdisciplinary team that supports the care. There is also an enormous appreciation that the care is just not clinical. There's a huge psychosocial aspect that is incorporated. That means, the CVU team learning who the individual is personally and their personal history, because that really helps them anticipate behaviors, moods. The other important aspect is engaging the family. Patient or resident is admitted to CVU. The family just does not hand over the family member. They're a part of the care. And so through that teamwork, you're really having multiple people anticipate and also be able to report back, how this individual's doing. And so CVU is able to replicate this on an individual level to like a programmatic level. And that really makes them stand out.
Marisol, I know that your mom was also at CVU. Can you tell us about what that experience was like?
Yeah, and it was certainly deeply personal for me that my mother needed care. So last year she fell, she fractured her hip, and after surgery, she needed short-term rehab. I've been in long-term care my entire career, focusing on quality, and now I'm choosing care as a daughter. But there was no doubt she was going to get her rehab at New York City Health Hospitals, CVU. And from the moment she was admitted, she received the best care. Like Khoi is mentioning, the team is incredible in providing person-centered care. So it wasn't just physical and her rehab, because that was outstanding, but it was really the entire interdisciplinary team working together and seeing my mom as a person, and addressing all of her needs that really, improved her. She's home. She's doing great. She's walking, and she's being the best abuela to my two sons. But I'm so proud to be part of the CVU team, the post-acute team, and this amazing system, because really it was a traumatic experience that was turned into healing. It was great.
How long was she there for?
3 weeks. Yeah, typical short term.
Tell them about the pain, because your mom had the pain. Marisol comes to me. Her mom had pain one day, right?
Yeah.
We pulled the team together right away. So her mother wouldn't be in
Yeah.
any pain.
Yeah. The director of nursing actually treated my mom's, pain with the attending physician. And the next day she was great.
Wonderful. I'm going to bring us to Roosevelt Island, where we have Health and Hospitals Kohler, which is also known for its exceptional memory care program. Marian, can you tell us what makes that program unique and how the team supports residents living there with memory challenges?
On Roosevelt Island, they have an assistant director of nursing that runs the program. It's psychiatry-led. The psychiatrist is really one of the most wonderful psychiatrists I've ever met, and I really, really mean that. He's a catalyst for the program. He takes each case, and he really, really works with the residents unbelievably. The programs that they have there are just marvelous. There's like 10 programs running at one time. You'll go there and there'll be somebody like doing a band program. It's the residents, doing the drums or whatever. There'll be somebody painting, in another room. They keep the residents so busy there, they're so engaged. So and that's, that's really good to lessen any unwanted behaviors, to keep the residents involved. And it's all resident-centered because maybe somebody doesn't want to paint, maybe somebody doesn't want to be in the bands. And also they have a really big open garden space there.
Oh, really?
That's wonderful. And they call it a fresh air program. So like the mental health aides will walk them around in the fresh air program, and they really, really enjoy that. I like to go there to that unit when I go, because it's amazing all the things. I watch them outside. They have the residents out there. They're dancing with the residents, and the residents really love it. The program's amazing there. I can't say enough about that. And the unit won a very big award. That's the Beacon Award.
Moving uptown, we're going to go to Harlem. Okay. And in Harlem, we have Carter. And I think this facility has just made national history as the first and only long-term care facility in the country to earn the Pathway to Excellence with Distinction Nursing designation. Can you tell me what that is? It's a long name, but it sounds great.
It's absolutely great. It was a long time coming. We've been working on this for a year, and for this pathway. And the application alone is 700 pages.
Gosh.
So it encompasses anything that can do with nursing, anything almost like on the same realm as a Beacon Award, but just like on steroids. The pathway's like the pathway's like the Oscar. It's like,
Really?
yeah, the pathway's like the Oscar. Well, honestly, it's unbelievable. So we had the honor of going in. There's 15,000 nurses that go to this conference. When you walk on the stage to get this pathway designation, people screaming. People taking pictures, a whole huge auditorium.
Take to a nursing conference.
It's just 15,000 nurses.
It's wild.
What's your secret to a workplace where nurses feel valued?
Honestly, you try to treat people with the way that you would like to be treated. And I really mean that. You can't come across like that you know everything, because you don't. You have to take everybody into consideration. Oh, maybe that's a good idea. If they feel valued and they know you're in your corner, they'll do anything, Doc, honestly. And I am so blessed to have the nurses that work for me, all the directors. They're absolutely wonderful, and it always comes down from the top, Khoi is our biggest cheerleader, honestly, for nursing. He really is.
Really?
He's such a cheerleader for nursing. And I think everybody feels it, because if they feel it from us, know they're totally valued, and even on a system level, they know they're totally valued. Everybody, there's so many programs for nursing from Health and Hospitals that are just unbelievable, And I think everybody knows that they're really, really valued, And our retention rate is really good.
We're going to jump to Lower Manhattan now, where we have Gouverneur. I used to work in the Gouverneur primary care clinic.
Oh, that's
right next to the building.
Right.
Skilled nursing facility.
Uh-huh.
I always wondered what else was in the building. But I know that Gouverneur recently celebrated its 140th anniversary, serving
Yeah.
the Lower East Side in Chinatown. Khoi, I know also Gouverneur has a really rich legacy of being the first municipal tuberculosis clinic. And now it's, a five-star rated skilled nursing and rehab facility. And we've been alluding to our rehab programs across the system. But Khoi, maybe you could tell us a little bit more about the structure of those programs. How do we rehab people? What's the staffing look like? What do those programs look like?
Sure. When a person comes into a Gouverneur, and so we kind of think of conceptually the population in two groups. There's the short-term population and then the long-term population. The short-term population are those who are mainly focused around rehabilitative programs and services. When this individual comes into Gouverneur, we think, okay, what is it, or what can we do to help rehab you to make you successful to return home and to remain home? There are a number of interdisciplinary team members that contribute to this. The aspects of care that we'd like to look at is the medical, which is a little more straightforward. We want to make sure that the acute issue from the hospital that is the reason why the patient was admitted there and then transferred to us continues to recover, does not decompensate. There are nursing care that will ensure that the patient continues to recover. And so nursing really provides the skilled care on a day-to-day basis. And then from a functional perspective where, we got to get the person up, walking, make sure they're stronger, they can lift themselves from like a shower chair or like a toilet seat. That's like our rehab team.
Mm-hmm.
And generally I would explain on like Monday through Friday, the patient can expect to have about 2 hours of rehab, though that will be broken up into like commonly physical therapy for an hour and then like occupational therapy for another hour. At times there may be a need for speech therapy, and that's woven into the day. And so the therapy time over the course of the day could be like 2.5 hours or so. The other licensed specialists that could come into play with the individual's care, psychotherapist. We also have a psychiatrist. And so behavioral psychosocial health is very important. And so if those needs come up, we have those practitioners. And then clinical nutrition is very important. And so a dietitian will come down, do an initial assessment, and then make recommendations of what the clinical diet should look like to support this individual's healing, but then also to keep all of the other like chronic conditions stable.
Mm-hmm. And so Marisol, you mentioned your mother had stayed for about 3 weeks. So like in the context of like kind of this post-hospitalization period, anybody who's had a family member go through the hospital and go to a rehab probably kind of understands, at least the experience of this. But for those who don't know, the major things after hospitalization is safety at home. Is what you really want people to be able to go home safely. Yep. And so everything that Khoi is talking about with physical therapy to strengthen your muscles and your ability to walk and function and do all the basic things that you need to do at home, like get in the shower and toilet and feed yourself and that kind of stuff.
Yeah.
So that's what our rehab programs are doing.
Yep.
Which is, and they're doing amazing work.
Yes.
Yeah, it's subtle work, but it's very important. Most people take it for granted when you can like walk, 3 avenues and you're like, oh, why wouldn't someone be able to take themselves to the bathroom? But you're like, no, for someone who is frail and older with like, 6 medical conditions, could be a milestone for them after.
Or dressing themselves, right?
I've even seen, young people who are in a hospital bed for a week.
Yeah.
You can't really imagine how much muscle you lose.
Yeah.
How much weaker you
Condition.
become.
Absolutely.
Yeah.
Mm-hmm.
Yeah.
It's very quick. Okay. We're going to bring us to Brooklyn, which is where I work.
Where do you work in Brooklyn?
Woodhull.
Ah, okay.
Yeah. I live in near work too. So I live in Brooklyn. And we have McKinney, which is a 320-bed skilled nursing and rehab center. And we have a lot of residents from our West Indies community there. McKinney's also home to one of our largest, this is interesting, solar installation in our hospital system to date. And so this is where I kind of want to ask you a little bit about our sustainability goals in the post-acute care setting. Sustainability is something that health systems are thinking about more and more. And I find it really interesting that one of our largest kind of projects is in our post-acutes. Khoi, can you tell us a little bit more about that?
Sure. So the solar project, I did not hatch that idea. However, I completely support the vision and the goal of sustainability. However, to speak a little bit about this, there's a larger capital sustainability project that the system has put forth, and so McKinney is just a site that was positioned to have this solar panel installed. And so that was a huge operational feat. Obviously, there was a lot of coordination between multiple stakeholders to ensure that the capital improvement work takes place. It runs smoothly, but then it also does not disrupt patient care. And so it was done successfully. I would say no big hurdles or obstacles. And so it's been up and running now, I think, for 6 months, and they're doing well. But on a lower scale, to talk about sustainability, we have an environmental service partner that helps us with waste management, and then we do set recycling targets for each of our facilities, and it's an ongoing competition to make sure recyclables go to where they need to. We also try to limit printing on paper. We're also looking at ways to reduce waste. And so it's a constant evaluation of just the day-to-day things that you can do that might not seem as grand as implanting big solar panels, but in the long run, these incremental changes will add to the greater good of sustainability.
Marisol, I'm saving the funnest for last. So I know there's a lot of programming that's super fun that happens in the nursing home. That we've alluded to, in terms of activities, but I've heard about karaoke shows, name that tune games, painting classes, Caribbean festivals. So I guess these are what we call therapeutic recreation.
Yes.
Can you tell us a little bit about that program?
Sure. And you're right. That's the fun stuff.
Yeah.
And it's actually the most important thing. We mentioned before, the long-term care residents, our facilities are their home. So the quality of life, these therapeutic recreation programs are so important for them. So the recreation therapists and our entire staff, they do incredible things. They bring, not only karaoke, music, art therapy, cooking classes, the cinema, movies, and then they also engage the community. There's a lot of community vendors who come into the facilities and provide, live music, entertainment. And then every season, every holiday is celebrated.
Mhm.
And really, that is the most important thing for our residents.
Everybody's birthday.
Yeah.
Everybody's birthday
nice.
celebrated.
Yeah.
Yeah. We've had a lot of holiday parties this week at our hospital,
Yeah.
one every day.
Yeah.
It's nice. Having more
So
of
it's
those
a spirit.
activities.
Yeah.
Keeps
Just-
everybody
right.
well-being good.
Yeah, it brings a sense of this is not just a healthcare facility, to the work and to our patients. I also know that, food, there's a big concentration on food, especially with, a very diverse population across our system. Can you tell us a little bit about that?
Sure. We have a large nutrition department, and we use Sodexo at most of our facilities. And the satisfaction, we actually did a PI on it just
Yeah.
recently, and we shared with the board in improving the dining experience, right? Because, the residents, they go to the dining room, and each of our facilities improve the experience where we're making it more of a home-like environment for them. They cater to different cuisines, right? In McKinney, they have the Caribbean flavors, and each of our facilities cater to the resident population. Food, again, just like the therapeutic recreation activities program, is very, very important to the residents. And that's actually one of the satisfaction areas that we're continuously, focused on.
Cool.
Mhm.
Very cool.
And did Kohler just, they have a dining room now.
Oh, really?
What is it?
A cafe.
Cafe.
Kohler Cafe.
Yeah.
Kohler Cafe.
Yeah.
Yes. So with Kohler, we learned that the usual food service was yielding really low satisfaction. And Kohler's population being more behavioral, they tend to be younger patients, patients who are also more physically able. These group of patients can, in residence, can walk freely through the building. And so a lot of the times you're thinking, all right, they don't like the food, they're walking around, like what can be conducive to like stabbing off like bad behavior, unsupervised, unstructured like time. And so I think with the creativity and the commitment of our nutrition partners, the facility identified an open, unused space that was refashioned as a cafe. And so strangely enough, it's similar food that would have been sent on a tray to the person's like room or the dining room. It's now like served in a cafe style where patients and residents can come and say, "Oh, salad bar. Can I please have these toppings with the lettuce?" Or no, I don't want that. I rather have a hot press sandwich. And so there's also an ability to make reservations. And so we've heard stories of like residents and patients going on dates. Yeah, and so they have like a
So special.
something to do, something to look forward to, and this is like really out of like creativity
Yeah.
that and it's thriving, and so it was remarkable, and
That's
so
really
I really
yeah.
Yeah, that's so cool. You kind of change up kind of the ability to choose what your day looks like and, what you want to eat.
Yeah, it's really about
It's
empowering.
a lot. Yeah.
Yeah, the other thing too is with like you mentioned before, the stigma with nursing home. It's difficult to make it feel less institutional.
Yeah.
And so this is one way that I think was possible, and it does absolutely break up, that feeling for people who reside there.
Yeah. Well, with 5 kind of very well acclaimed post-acute centers, many wards, I just want to congratulate you all on the work, as well as all of your staff and teams that are
The
working
teams
really
are
hard every single
incredible.
day.
Yeah.
I want to end by asking you all where you think the post-acute landscape is heading in the next couple years, or where do you think our system is heading with it?
I think just a continued use of data to not only improve the quality of care, but the quality of life of our residents, and not only the residents, but the staff as well, and having it transparent, right? I know that the hospitals, they have patient satisfaction data available to the public. Long-term care is definitely going, that route more and more.
More transparency.
Absolutely.
And I think, what Marisol and Marian mentioned, I think what I will add is from a practice standpoint, most health systems through the United States, to my understanding, do not own either a skilled nursing facility or nursing home. It's very few. And so what they do is they come up with a post-acute network that they can, rely on. And so, that process, I think, can be difficult to manage because you're dealing with an external partner. With us, we are situated in a health system. So I think, our health system is becoming more integrated. It is maturing. And so I think in the next few years, we can look forward to having very tight, seamless clinical integration between all the different settings. And so, post-acute being situated in there, I think we'll start to have a more defined role with how we care for like special populations of, how we identify them. And then they can seamlessly go from one area to the next. And there's full patient navigation, visibility on like what's needed so that no patient really falls through the cracks. And with the mission of our health system, we have very complicated patients with very complicated lives. And so giving them the healthcare that they need does require, more intensity. And so I think we are able to do that and position to do that.
I said last question, but final words about what would you tell a family member of our patients about the kind of care that defines our nursing homes?
Very kind, person-centered. You're treated, your whole person.
Yeah, I would say you can send your family to us because we do.
I think we could use what Kohler uses. Kohler has a slogan, Kohler's the place to be. So I think our nursing homes are the place to be, absolutely.
Yeah, we're quite proud of our nursing homes and skilled nursing facilities.
That's all the time we have today. I just want to say really big thank you to Dr. Khoi Luong, Marian McNamara, and Marisol Arroyo. Thank you so much for joining us.
Thank you.
I appreciate being
Thank
here.
you.
Thank you.
Thank you.
And thank you to the incredible teams across our 5 skilled nursing facilities for providing excellent, equitable care to New Yorkers every day. From Harlem to Staten Island, our nursing homes are setting a national standard, proving that post-acute care can be both compassionate and cutting edge. Finally, thank you for listening to The Remedy. Don't forget to subscribe and leave a review wherever you get your podcasts. I'm Dr. Michael Shen, and I'll see you next time.
This podcast was produced in partnership with Amaze Media Labs.